The pattern started when I was 19. Foundation internship? Dad had scoffed, reading my acceptance letter. That's not a real job. That's volunteer work with a fancy title. Mom agreed. Your brother is studying cardiology at Johns Hopkins. That's a career path. This is just community service. I'd folded the letter carefully and said nothing. My older brother Michael became a cardiologist. Brilliant, ambitious, successful. By 35, he was Chief of Cardiology at Riverside Medical Center, a prestigious hospital system in our state. His salary exceeded $420,000 annually. He owned a house worth $2.4 million. He drove a Porsche. Our parents displayed his accomplishments like museum pieces. My foundation work received polite disinterest at best, open mockery at worst. What they didn't know, I'd spent 14 years building something extraordinary. I started as an intern at the Westfield Healthcare Foundation, processing grant applications and filing paperwork. By 23, I was analyzing funding proposals. By 27, I was managing entire grant portfolios. By 30, I joined the executive leadership team. At 33, I was offered executive director. The Westfield Healthcare Foundation controlled assets worth $4.7 billion. We funded medical research, hospital expansions, equipment purchases, and healthcare access programs across 7 states. My decisions affected thousands of healthcare providers and millions of patients. Last year alone, we distributed $380 million in grants. Major hospital systems competed for our funding. Medical research institutions courted our support. Healthcare executives knew my name because I controlled access to resources they desperately needed, including Riverside Medical Center where my brother worked. But my family had no idea. Christmas Eve at my parents' house in suburban Maryland. The living room was decorated with expensive taste, 12-foot tree, designer ornaments, catered dinner for 23 relatives. Mom had hired a photographer to capture the perfect family Christmas. Michael arrived with his wife Jennifer, also a physician. They just returned from skiing in Aspen. Michael, tell everyone about the expansion, Mom prompted as we gathered for dinner. Michael smiled, confident and polished. Riverside is building a new cardiovascular center. It's a $92 million project. State-of-the-art catheterization labs, advanced imaging equipment, dedicated research facilities. It'll be the premier cardiac care facility on the East Coast. That's incredible, Aunt Linda said. We've secured $42 million through hospital reserves and private donations, Michael continued. We're applying to the Westfield Healthcare Foundation for the remaining $50 million. If approved, we break ground in April. My fork paused. Westfield Healthcare Foundation. My foundation. I kept eating, expression neutral. You'll get it, Dad said confidently. Look at your credentials. Look at Riverside's reputation. Any foundation would jump at the chance to fund your program. The application is strong, Jennifer added. Michael personally wrote the clinical outcomes section. His research data is compelling. How competitive is the process? Uncle David asked. Very, Michael said. But Riverside's cardiovascular mortality rates are 23% below national averages. Our readmission rates are exceptional. Our patient satisfaction scores are in the 98th percentile. The foundation would be foolish to pass on us. To Michael, Mom raised her glass. Building the future of cardiac care. Everyone toasted. I took a sip of water. The conversation shifted to Michael's recent publication in a cardiology journal. Then to Jennifer's promotion to Associate Professor of Medicine. Then to their daughter Sophie's acceptance to a prestigious private school. Emma, you're quiet, Aunt Linda observed. How's your foundation work? The way she said it, dismissive, slightly pitying. It's going well, I said simply. Still doing administrative stuff? Michael asked. Yes. Mom sighed. Emma, honey, when are you going to pursue something more substantial? You're 33. You should be building a real career by now. I have a career. Volunteer coordination isn't a career, Dad said. It's a hobby that happens to pay a small salary. Foundation work is legitimate, Aunt Linda's husband Tom said mildly. He was an accountant. Nonprofit administration requires real skills. Please, Mom waved her hand dismissively. It's not comparable to medicine or law or business. It's playing philanthropist without actually having money to give away. Emma processes paperwork for wealthy donors. That's not the same as saving lives like Michael does. Michael looked slightly uncomfortable but didn't disagree. Emma could do so much more, Mom continued. She's intelligent. She just lacks ambition. Instead of building something meaningful, she's content to sit in some foundation office shuffling grant applications. Quit pretending to be philanthropic, Jennifer said, her tone sharp. Get a real career. You're wasting your potential on feel-good nonprofit nonsense. That's harsh, Tom protested. It's honest, Jennifer said. Emma's been doing this for over a decade. No advancement. No real impact. Just spinning her wheels in the nonprofit sector while her brother changes the field of cardiology. Dad nodded. We're concerned, Emma. You're 33 and still in an entry-level position. Meanwhile, Michael is leading a major medical center department. The contrast is stark. My work is meaningful to me, I said calmly. Meaningful, Mom repeated. That's what people say when they can't achieve actual success. Oh, we love you. But at some point, you need to accept that you're not cut out for competitive high-level careers. There's no shame in that. Not everyone can be like Michael. The table went quiet. Michael shifted uncomfortably. Mom, that's not fair. It's realistic, Mom interrupted. Emma chose a safe, low-pressure career path. That's fine. But she shouldn't pretend it's equivalent to actual professional achievement. Foundation work is legitimate, I said quietly. Foundation work, Jennifer laughed, is where mediocre professionals go when they can't handle real pressure. It's nonprofit welfare for people who can't make it in competitive fields. That's not true, Tom said firmly. It absolutely is, Jennifer insisted. Foundations are bureaucracies that exist to make wealthy donors feel important. The staff are glorified assistants who rubber-stamp funding decisions. Emma probably processes donor thank you letters and maintains spreadsheets. That's not a career. That's clerical work with philanthropic branding. My role is more complex than that, I said. I'm sure you tell yourself that, Mom said gently, condescending. But sweetheart, be honest. You're not leading anything. You're not creating anything. You're supporting other people's philanthropy. That's fine for some people. But we raised you to be exceptional like your brother. Maybe Emma just isn't exceptional, Uncle David said, shrugging. Not everyone is. Michael got the ambition and drive. Emma got different qualities. Exactly, Dad said. Emma is kind and earnest. Those are lovely traits. They're just not the traits that lead to professional success. I set down my fork. You're all very certain about my career. We're being realistic, Mom said. Foundation work is worthless in terms of real professional development. You're 33 with no significant achievements. That's concerning. Worthless, I repeated. Yes, Jennifer said bluntly. Worthless. You're not building expertise. You're not gaining authority. You're not developing leadership skills. You're processing paperwork in a nonprofit backwater. In 10 years, you'll still be doing the same meaningless tasks while people like Michael are transforming healthcare. Everyone nodded or stayed silent. I smiled slightly. That's an interesting perspective. It's the truth, Dad said. And Emma, we're telling you this because we love you. It's not too late to change direction. Michael could probably help you get an entry-level hospital administration position. Start building a real resume. That's generous, I said evenly. The photographer called everyone to gather for family photos. We arranged ourselves in front of the tree. Mom and Dad in the center, Michael and Jennifer prominently positioned, me off to the side. The perfect family Christmas. The foundation board meeting was scheduled for December 27th. Our conference room on the 14th floor overlooked the city. 23 board members. Physicians, hospital executives, research directors, community health experts, financial advisors. Combined, they represented over 400 years of healthcare leadership experience. I sat at the head of the table as executive director. We have 31 funding requests this quarter, I began. Total asks exceed $580 million. Our available distribution is $125 million. We'll need to prioritize carefully. Dr. Patricia Morrison, our Chief Medical Officer, distributed evaluation summaries. Several strong applications. Riverside Medical Center has requested $50 million for cardiovascular center expansion. On paper, it's impressive. I've reviewed that one, said James Holland, our health equity director. The clinical outcomes are excellent. However, I have significant concerns. Such as? Dr. Morrison asked. Riverside serves a predominantly wealthy demographic, James said. 81% of their cardiac patients have private insurance. Only 7% are Medicaid patients and 2% are uninsured. For comparison, the regional average is 24% Medicaid and 8% uninsured. Board member Dr. Kenneth Lee frowned. That's a substantial disparity. It gets worse, James continued. Riverside is located in an affluent suburb, but they're within 15 miles of 3 underserved urban areas with high rates of cardiovascular disease. Their charity care provision is only 4% of total services. They're essentially operating as a boutique cardiac center for wealthy patients while low-income communities go underserved. What about their outreach programs? Asked board member Sarah Chin, a public health expert. Minimal, James said. They offer some community education seminars, but no transportation assistance, no mobile screening, no meaningful access initiatives for low-income populations. They've built a high-end facility that's geographically close to underserved areas but functionally inaccessible to them. Dr. Morrison looked troubled. The clinical excellence is undeniable. Dr. Michael Chin, their Chief of Cardiology, has exceptional outcomes. For the patients who can access him, James emphasized, which are overwhelmingly wealthy, insured, predominantly white patients. Meanwhile, low-income communities and communities of color have cardiovascular mortality rates 40% higher than Riverside's patient population, partly because they can't access facilities like Riverside. I reviewed my notes. This $92 million expansion, does it include any provisions for increasing access? James shook his head. The proposal focuses entirely on advanced technology and luxury amenities. Private patient suites, concierge services, valet parking, premium accommodations. It's designed to attract affluent patients, not serve underserved populations. That's inconsistent with our mission, Sarah said firmly. We fund healthcare access and equity. This would be funding healthcare exclusivity. But the clinical outcomes, Dr. Morrison began, are excellent for wealthy patients, James interrupted. That's not in question. But our foundation's mandate is clear. We invest in healthcare that serves all communities, especially underserved populations. Riverside is requesting $50 million to build a luxury cardiac center for the wealthy while ignoring cardiovascular health crises in nearby low-income neighborhoods. Board member Robert Taylor, a hospital CFO, spoke up. Could we make funding conditional? Require them to develop access programs? We could, I said. But that shifts our role from supporting existing commitment to mandating new priorities. It also requires extensive monitoring and enforcement. Our most successful grants fund institutions already demonstrating equity commitment, not institutions retrofitting it for funding. What's Riverside's response to equity concerns? Sarah asked. I raised them in our preliminary review, I said. Dr. Chin, the Chief of Cardiology, indicated that Riverside serves all patients who seek care. He stated that demographic patterns reflect patient choice, not institutional barriers. James scoffed. Classic deflection. If you build an expensive facility in an affluent suburb with no transportation access, no Medicaid acceptance clarity and intimidating luxury branding, you've created barriers. Then claiming all patients choose to come is disingenuous. Dr. Chin is the applicant's brother, Dr. Morrison noted, reading the file. I nodded. Yes. Dr. Michael Chin is my older brother. I've disclosed the relationship. If the board prefers, I can recuse myself from this decision. No need, Sarah said immediately. You've been objective in your assessment. The equity concerns are valid regardless of family relationship. The board discussed Riverside's application for 90 minutes. Dr. Morrison advocated for approval with conditions. James and Sarah firmly opposed funding without demonstrated equity commitment. Other members were divided. Finally, board chair Dr. Raymond Foster looked at me. Emma, your recommendation? I chose my words carefully. Riverside Medical Center provides excellent cardiac care to patients who can access them. The proposed expansion would enhance that excellence. However, our foundation's mission prioritizes healthcare equity and access. Funding this proposal would invest $50 million in serving an already well-served affluent population while underserved communities continue facing cardiovascular health crises. Your recommendation? Dr. Foster repeated. Deny the current application, I said clearly. Invite Riverside to reapply with a revised proposal that includes comprehensive access initiatives, transportation programs, Medicaid navigation support, community health worker partnerships, and mobile screening in underserved areas. If they demonstrate genuine commitment to serving all communities, we'll reconsider. Dr. Morrison looked disappointed. James and Sarah nodded approvingly. All in favor of denying Riverside's current application? Dr. Foster asked. 15 hands raised. Opposed. 8 hands. The application is denied, Dr. Foster confirmed. Emma, please draft the decision letter and invite them to submit a revised proposal addressing equity concerns. I nodded and made notes. The meeting continued through other applications. We approved $47 million for a community hospital network expanding stroke care in rural areas. We funded $23 million for a research consortium studying cardiovascular health in underserved populations. We approved $18 million for a hospital system launching mobile cardiac care units. Each funded proposal demonstrated commitment to healthcare equity. Riverside's application had been purely about clinical excellence for the wealthy. My phone started buzzing during the drive home. Michael. 6 missed calls. I pulled over and called back. Emma. His voice was strained. Did you hear about the Westfield Foundation decision? What decision? Our funding request was denied. Denied. They said our equity metrics are insufficient. Equity metrics. We have the best cardiovascular outcomes in the region. I'm sorry to hear that. This is catastrophic. We need that $50 million. Without it, the expansion is dead. 3 years of planning gone. The hospital board is furious. My reputation is damaged. How could they deny us? Perhaps they had concerns about your application. Concerns? We're one of the top cardiac centers in the country. Our mortality rates are 23% below average. We have cutting-edge technology, world-class physicians, exceptional patient satisfaction. What more could they possibly want? Healthcare equity, I said quietly. What? 81% of your patients have private insurance. Only 7% have Medicaid. You provide 4% charity care when the average is 15%. You're located near underserved communities with high cardiovascular disease rates, but you've built no programs to serve them. The foundation funds healthcare access for all populations, not luxury care for the wealthy. Silence. How do you know our application details? Michael asked slowly. I'm the executive director of the Westfield Healthcare Foundation. Long silence. You're what? I've been with the foundation for 14 years. I was promoted to executive director 3 years ago. I oversee all grant decisions. Your application came before our board this morning. I led the evaluation. You're in charge of the foundation? Yes. The $4.7 billion foundation? Yes. You denied my application? The board denied it. I recommended denial based on insufficient commitment to healthcare equity. Your facility serves wealthy patients almost exclusively while ignoring underserved communities. That's inconsistent with our mission. I don't understand. You work in nonprofit. That's not a real career. That's not real authority. I direct the largest healthcare foundation in 7 states. I control $125 million in quarterly grant funding. Hospital CEOs call me. Research directors court me. Healthcare systems need my approval to fund major projects. Your hospital needs my approval. And I denied it. Michael's breathing was audible. But you process donations. You're administrative support. I'm executive director. I lead a staff of 84 professionals. I chair board meetings with some of the most accomplished healthcare leaders in the country. Last year we funded 127 projects affecting over 2 million patients. Your career exists within a healthcare ecosystem that foundations like mine financially support. This can't be real. It's very real. And Michael, your application revealed exactly what our family sees as success. Clinical excellence for wealthy patients. Luxury accommodations. Premium services. All serving people who already have resources while low-income communities are ignored. That's not healthcare leadership. That's healthcare elitism. We serve anyone who comes to us. You've built barriers that prevent underserved populations from coming. No transportation programs. No community outreach. No Medicaid navigation. No effort whatsoever to reach beyond your affluent demographic. You've created a boutique cardiac center for the rich. That's not fair. It's accurate. And it's exactly why the board denied your funding. We invest in healthcare equity, not healthcare exclusivity. Emma, please. This expansion is critical. My career depends on it. The hospital depends on it. Then develop a genuine equity plan. Create transportation programs for low-income patients. Partner with community health workers. Launch mobile screening in underserved neighborhoods. Increase your Medicaid acceptance. Provide substantial charity care. Demonstrate actual commitment to serving all communities. We can do that, Michael said quickly. We'll add equity components. Whatever you need. It's not what I need. It's what underserved communities need. And I question whether Riverside is genuinely committed or just checking boxes for funding. We're committed. I'll personally develop programs. Then submit a revised proposal. Include detailed equity initiatives with measurable goals, timeline commitments and budget allocations. The board will review it fairly. But Michael, understand something. Your clinical excellence alone doesn't qualify you for funding. Healthcare equity matters. Accessibility matters. Serving underserved populations matters. Those aren't bureaucratic obstacles. They're moral imperatives. Michael was quiet for a long moment. Why didn't you tell us? About your position? Would it have changed how you talked to me? Yes, he admitted. That's the problem. The work matters regardless of the title. Foundation work matters because it funds the healthcare system you operate within. Dismissing it as worthless reveals fundamental misunderstanding of how healthcare actually functions in this country. Hospitals like yours exist because foundations, government programs, and insurance systems fund them. We're not support staff for your brilliance. We're strategic investors in healthcare access. I didn't understand. You didn't try to understand. For 14 years, you've dismissed my career as meaningless nonprofit work. You've treated me like a failure because I don't drive a Porsche or own a $2.4 million house. You've never once asked what I actually do or why it matters. Emma, I'm sorry. Save it. Submit your revised proposal. Focus on equity. And Michael, learn something from this. Clinical excellence without accessibility is privilege, not leadership. You're brilliant at cardiac surgery. But brilliance means nothing if it only serves the wealthy while underserved communities die of preventable heart disease. I ended the call. The decision letter went out the next morning. The Westfield Healthcare Foundation Board of Directors has carefully reviewed Riverside Medical Center's application for cardiovascular center expansion funding. While we recognize the clinical excellence of your program, we have significant concerns regarding healthcare equity and access. The letter outlines specific deficiencies. Low Medicaid patient percentages, minimal charity care provision, absence of community outreach programs, lack of transportation access for underserved populations. We invite Riverside Medical Center to submit a revised proposal that includes comprehensive equity initiatives demonstrating commitment to serving all communities, particularly underserved populations disproportionately affected by cardiovascular disease. My assistant delivered the letter via email and certified mail. Within 2 hours my phone was ringing constantly. Mom called. Emma, Michael says you rejected the hospital's funding? The board denied the application, yes. But why? He's your brother. How could you not support him? I support healthcare equity. Riverside's application didn't demonstrate adequate commitment to serving underserved populations. That's bureaucratic nonsense. Michael saves lives. He saves lives for wealthy patients. Low-income communities have cardiovascular mortality rates 40% higher than Riverside's patients because they can't access facilities like his. That's not acceptable. You're punishing your brother for being successful. I'm holding a healthcare institution accountable to equity standards. If that feels like punishment, it reveals how accustomed Riverside is to operating without accountability. Mom hung up. Dad called. This is ridiculous, Emma. You're letting some nonprofit politics interfere with family loyalty. I'm doing my job with professional integrity. Your job is worthless. You said it yourself, it's just processing grants. My job controls $4.7 billion in healthcare funding. Hospital systems across 7 states depend on our grants. Research institutions need our support. Community health programs exist because of our funding. That's not worthless. That's power. And I'm using it to advance healthcare equity. You've always been jealous of Michael. I'm not jealous. I'm disappointed. Disappointed that my brilliant brother built a luxury cardiac center for the wealthy while ignoring health crises in nearby underserved communities. Disappointed that our family measures success by salary and house size rather than actual impact. Disappointed that none of you respected my work until you needed something from me. I ended the call. Jennifer called. You're destroying Michael's career because you resent his success. That's pathetic. I'm doing my job. Your job is meaningless. You're a paper pusher having a power trip. I'm executive director of a $4.7 billion foundation. I control healthcare funding that institutions like Riverside desperately need. If that's meaningless, why is Michael panicking? She hung up. The revised application arrived 4 weeks later. It was dramatically different. Riverside committed to increasing Medicaid patients to 20% within 3 years. They proposed a $3.8 million transportation program providing free rides for low-income patients. They outlined partnerships with 3 community health centers in underserved areas. They committed to 15% charity care provision. They allocated $5.2 million for mobile cardiac screening units targeting high-risk communities. Michael had attached a personal letter. Emma, I've spent the past month visiting community health centers and talking to patients who can't access cardiac care. You were right. I've been operating in a bubble of privilege, serving wealthy patients while ignoring desperate need in nearby communities. This revised proposal represents genuine commitment to change, not checkbox compliance. I'm asking for a chance to prove Riverside can serve all communities. The board meeting was scheduled for late January. James reviewed the revised proposal. This is substantially improved. The equity commitments are comprehensive and well-funded. The community partnerships are meaningful. If implemented as written, Riverside would become a model for accessible cardiac care. Sarah nodded. My concerns are addressed. This demonstrates genuine institutional change. Dr. Morrison smiled. Clinical excellence plus equity commitment. It's exactly what we should fund. The discussion was thorough but positive. Board members asked detailed questions about implementation timelines, community partnership structures, and accountability metrics. The revised proposal addressed everything. All in favor of approving Riverside's revised application? Dr. Foster asked. 21 hands raised. 2 abstentions. The application is approved, Dr. Foster confirmed. Funding will be disbursed in phases contingent on verified implementation of equity initiatives. I drafted the approval letter that afternoon. Michael called that evening. We got it. Emma, we got the funding. Congratulations. Thank you. Seriously, thank you. Not just for the funding but for pushing us to be better. The transportation program launches in May. We're already hiring community health workers. We're partnering with clinics in underserved neighborhoods. That's excellent. I've been reading about cardiovascular health disparities. The statistics are horrifying. Low-income communities have heart disease rates 40% higher than our current patient population, but only a fraction access specialized care. We've been serving the healthiest, wealthiest demographic while the sickest communities go untreated. Yes. That's morally indefensible. I'm ashamed it took your foundation denying us for me to see it. What matters is that you see it now. Emma, I need to apologize. Really apologize. At Christmas, I sat there while Mom and Jennifer called your work worthless. I didn't defend you. I agreed with them. I thought your career was insignificant compared to mine. Yes, you did. I was arrogant and wrong. Your work is transformative. You're changing how institutions like mine operate. You're forcing us to examine who we serve and who we exclude. That's systems-level change. That's more impactful than anything I do in surgery. Both matter, I said. Clinical care and systems change both matter. But I dismissed your work for 14 years. I treated you like you were less successful than me because your salary was lower and your job wasn't prestigious. I'm deeply ashamed. Michael, this isn't about forgiveness. It's about respect. Respect for all work that creates positive impact regardless of prestige or salary. The janitor at your hospital matters. The community health worker matters. The grant administrator matters. Everyone contributing meaningful work deserves respect. You're right, he said quietly. I've been so focused on status and achievement that I forgot what actually matters. Helping people. All people, not just wealthy ones. Remember that when you're implementing your equity programs. I will. Emma, thank you for not giving up on us. You could have denied the revised application. I wouldn't have blamed you. I evaluate applications based on impact potential, not personal relationships. Riverside can now create significant impact for underserved communities. That's what matters. The family group chat was quiet for several weeks. Then Mom sent a message. Family dinner this Sunday. We need to talk. I almost declined, but eventually agreed. Everyone gathered at my parents' house. The atmosphere was subdued, awkward. Mom set down her wine glass. Emma, we owe you an apology. A profound apology. Multiple apologies, Dad added. We dismissed your career for years, Mom continued. We treated you like you'd failed because you weren't like Michael. We called your work worthless. We were cruel and ignorant and wrong. Jennifer spoke up, her voice tight. I said terrible things at Christmas. I called your work meaningless. I told you to get a real career. I'm mortified by my arrogance. We all said terrible things, Uncle David admitted. We judged you based on salary and prestige instead of actual impact. Aunt Linda nodded. We're very sorry, Emma. Your work is clearly extraordinary. We should have recognized that. Michael stood. Emma changed Riverside Medical Center. Not just by providing funding but by forcing us to examine our values. We're now building programs that will serve thousands of underserved patients. Children will get cardiac screenings they would have missed. Low-income adults will access treatment they couldn't afford. Lives will be saved because Emma refused to fund excellence without equity. That's the Foundation's mission, I said. We invest in healthcare access. You do more than that, Michael said. You create accountability. You push institutions to serve all communities, not just privileged ones. That's leadership that changes healthcare systems. Jennifer added, Michael's been talking about your foundation constantly. The entire hospital is reassessing equity. Other departments are examining their own demographic patterns and access barriers. That's the ripple effect we hope for, I said. One institution improves, others notice, standards shift. You're creating systemic change, Michael said. That's more powerful than individual patient care. I save lives one at a time. You save thousands by transforming how healthcare institutions operate. Both matter, I emphasized. Clinical care and systems equity both matter. The conversation continued, but the tone was different. People asked genuine questions about foundation work. They listened carefully. They treated my career with respect. It was what I'd wanted for years. But I'd also learned something crucial. My work's value had never depended on their recognition. Healthcare equity mattered because of its impact on real communities, not because my family finally acknowledged it. The foundation would continue funding hospitals, research, and community health programs whether they understood it or not. Patients would receive treatment. Communities would gain access. Health disparities would narrow. That was what mattered. Not their approval. Not their respect. Not their belated recognition. 6 months later, Riverside opened their first mobile cardiac screening unit. They parked in a community center parking lot in a low-income neighborhood. Free screenings. Free EKGs. Free blood pressure monitoring. Community health workers guided families through the process in English and Spanish. They screened 127 people the first week. They identified 8 cases of severe hypertension, 3 cases of dangerous arrhythmia, and 2 cases of advanced heart disease, all previously undiagnosed because these patients couldn't access cardiac care. All 11 received immediate treatment through Riverside's new low-income patient navigation program. Michael sent me photos. Families lined up at the mobile unit. Community health workers taking blood pressure readings. Patients receiving test results and referrals. His text was simple. This is healthcare. Real healthcare. Thank you for showing us what we were missing. I saved the photos. 3 weeks later, I visited the mobile unit myself. Watched families arrive nervously, leave with information and resources. Watched community health workers explain cardiac health in accessible language. Watched Michael himself screening patients, spending time with each person regardless of insurance status. He saw me and waved me over. Emma, meet Mrs. Rodriguez. We diagnosed severe coronary artery disease at her screening last week. She's scheduled for bypass surgery next Tuesday. Mrs. Rodriguez smiled, holding her grandson. I had chest pain for 2 years but no doctor. Too expensive. This mobile clinic saved my life. The foundation made this possible, Michael told her, gesturing to me. My sister runs the foundation that funded this program. Mrs. Rodriguez took my hands. Thank you. Thank you for caring about people like me. I felt tears forming. You're why we do this work. After she left, Michael and I stood watching the line of waiting families. This is what you saw, he said quietly. When you reviewed our application, you saw what we were ignoring. Communities like this, desperate for care, completely invisible to our boutique hospital. You could have just denied us. Instead, you pushed us to become better. That's what the foundation does. You change institutions, Michael said. You use funding as leverage for equity. That's brilliant. That's powerful. And I'm sorry it took me 33 years to recognize your brilliance. The work was always brilliant, I said. You just couldn't see it. He nodded. I see it now. Emma, I'm proud to be your brother. Genuinely proud. Not because you control a $4.7 billion foundation, but because you use that power to change lives for people the healthcare system usually ignores. We watched Mrs. Rodriguez walk to her car, her grandson holding her hand, her cardiac surgery scheduled, her life saved. Because the foundation demanded equity. Because systems change creates individual impact. Because my worthless work mattered. It had always mattered. And finally they understood.